Yeah, good morning, colleagues. I want to be sure that my voice is audible. Sorry, I need a yes from
Yes.
someone.
Good morning, Prof. Yes, sir.
Oh, good morning. Thank you so much. I'm happy to be here today. Thank you very much. Yeah, I would like to introduce the speaker of today, and a thing of joy and privilege to me to have Dr. Mojisola Oluwashanu with us today. And I would like to briefly introduce her because we've passed the hour of 8 already. So Dr. Mojisola Oluwashanu is a senior lecturer and researcher at the Department of Health Promotion and Education, Faculty of Public Health, College of Medicine, University of Ibadan, Nigeria. Our areas of research expertise include health promotion, health policy research, reproductive health, non-communicable diseases, prevention and implementation science, and also in the development sector. She worked as a program officer and manager for 8 years from 2004 to 2012 with the Association for Reproductive and Family Health after transitioning to a faculty position in 2012. She's been involved in studies on non-communicable disease prevention, especially the behavioral policy and community-based interventions that influence the modifiable risk factors. She has disseminated research findings at regional and international conferences, as well as published articles. Well, let me say several articles in scholarly and peer-reviewed journal. So I want you to join me as we welcome Dr. Oluwashanu this morning. We are glad that you are here with us, and I'm sure that every one of us will find this moment very, very interesting, and we are all ready with a pen and our notes. So welcome once again, Dr. Oluwashanu. You can kindly share your screen, please. Yeah, Dr. Oluwashanu is with us already. I am sure she's trying to share her screen.
Yeah, just a minute.
Thank you so much. You're welcome, ma'am. Okay, while she's trying to do that, she's almost done. I would like to remind us that the session that we are about to listen to and the previous ones that we have been listening to, so is organized by the Plus-CircleCommunityHealth Advancement Organization. And we have been doing this for some times, and we have some other projects. I'm sure that the colleagues that joined earlier, they already saw that on the slideshow. So I don't need to spend time repeating that. Over to you, Dr. Oluwashanu. Thank you.
Okay, good morning, everyone. And it's a pleasure to be invited to present today. And many thanks to Dr. Adesomi and the management of Plus-Circle Community Health Advancement Organization for the opportunity. The title of my presentation is Aligning Research Objectives and Conceptual Frameworks. Aligning research questions to theoretical and conceptual framework. At some point, I will have to stop my video because I'm not too sure if the internet connection is very, very stable. So this is the outline for the presentation. I'll be talking about some key terms that are relevant to this discussion. I will specifically defining conceptual and theoretical framework. I'll be talking about the benefits of theoretical and conceptual framework in research, and I'll be talking about some popular theories used in health promotion research, health systems and policy research, and implementation science. And finally, I would outline practical steps to align your research questions to theoretical and conceptual framework. I want to be sure you can hear me because at some point I saw that my internet connection is saying it's unstable. So if you can hear me,
yes, we can hear you. You are fine. Thank you.
So this is the objective of the study of the presentation in line with the outline that I presented earlier. I'll start by saying that it's important for researchers to use theoretical and conceptual frameworks when designing their study. This is very central to research processes and research outcomes. Researchers should actually consider using this framework early on when they are writing their proposal. It's not something you just introduce midway into your study or at the tail end of your study. I've had people come to consult me that, they did not start out with a conceptual framework or theoretical framework at the start of their study. And is it possible to come and integrate it after they have collected their data? That is not the best practice. The best practice is that you'd integrate you develop your theoretical or conceptual framework early while you are developing your proposal. So this helps to guide your thought process and helps you to appreciate the linkages between various concepts, various constructs, and various theories. So aligning your research question to your theory or conceptual framework ensures that your study is coherent and logical. At times you read studies and you wonder, how did they put up the variables that were assessed? There really is the theory that holds the study together. So your framework helps to hold your study together. You know the variables to assess, you know the constructs of inputs to the phenomenon under investigation. A framework can make your research finding more meaningful. It can even give it a very solid foundation. And it's easy for other researchers to relate to it because they are familiar with some of these frameworks. So when you say you're using a particular framework, they know what to expect. And it's really very important to do this. So to lay a solid foundation for our discussion this morning, I'll be discussing or defining some key concepts, very, very important to this topic. So we all know what a frame is. A frame is a structure that holds, sustains, encloses, and delineates something. Just think of a frame in your living room. A frame holds the picture. So when you place a picture in the frame holds the picture, it encloses it, it delineates it, it sets a boundary around the picture and the wall. So that is what a frame is. So building on this and talking about research framework, a research framework is a structure that offers direction for researchers as they refine their study questions, as they select methods for data analysis, and as they plan their data analysis. I want to really say that two terms, conceptual framework and research framework, it's something that a lot of doctoral students, a lot of researchers struggle with. They find it difficult to establish the difference between these two terms. So at times, those terms are used interchangeably, but they are different. So I will go on to talk about the differences or explain what we mean by conceptual framework and theoretical framework. So what I've just explained now is the research framework, which is a framework is common to both terms. It's a structure that offers direction for researchers as they define their study. Okay, so I will start with the term theoretical framework. So theoretical framework is a framework that provides guidance for researchers, and it is developed based on an established coherent theory which explains the phenomenon. I want you to note that emphasis on established coherent theory. That is one of the main differences between a theoretical framework and a conceptual framework. The theoretical framework is guided by theory. So it is made up of theory. So a theoretical framework incorporates the perspective of leading experts in the field because they've published in that field, they already have expert knowledge. So it builds on it, it leverages on it. It connects previous studies and your intended study. So the main thing you should know when you're talking about the theoretical framework is the fact that it is based on existing theory, which is supported by empirical data. So before I go on further, let me just to be sure that you all have a common understanding, let me use a metaphor for the world of architecture. I'm sure you all know that when they want to build structures or big buildings, high-rise buildings, the builders or the architectures, they develop what we call the scaffolding. And the scaffolding is supposed to help the builders, have access to the building. They're supposed to stand on the scaffolding as platforms to build the house. So in a similar vein, for researchers, your framework is supposed to be like the scaffold. It helps you to delve into the research. You stand on it. It's a platform that you stand on to do your research. And that scaffold also has what we call the constructs. And sometimes they call it the concepts. So these concepts are like boxes. It gives you an idea of what to look into. It helps you to build your research. So you can liken your theoretical framework to a scaffold. So let me go on to quickly say that having access to a lot of data doesn't really translate to excellent study or the fact that you're going to get something good out of it. As researchers, if you really want to have or maximize the outcome of your data, you need a theoretical lens to observe and analyze data. And that is why you need a theoretical framework. The theoretical framework gives you the focus. It helps you to zoom in on issues that are of import as you analyze issues. So it helps you to decide what to look for, where to look for, how to look for things while you are conducting your research. So let me move on to the conceptual framework, which is the second term of importance for this study. So the conceptual framework is defined as a system of concepts that frames the research question. It identifies the variables and constructs. It also helps you to see the relationships or connections between your variables. Basically, the goal of a conceptual framework is to help you to categorize and describe concepts relevant to the study. But the main difference between these is the fact that for a conceptual framework, it is largely your own conception of the phenomenon under investigation. It is your understanding, it is your conception. Unlike theoretical framework, you get it from the literature. It's already there, you just select it. But for conceptual framework, you have to be the one to develop the conceptual framework. And it can be guided by theory. For instance, you've done the literature review, you have read several materials, and based on that, you can come up with the concept. It could also be based on your experience in the field, experience conducting research in that area. So the main difference between the conceptual framework and the theoretical framework is the fact that for theoretical framework, it is based on existing literature, it is based on existing theories supported by empirical data, while for conceptual framework, it is based on your conception of the phenomenon under study. And that your conception can be inspired by theories already in the field. But you didn't just pick a theory, you have to pull up different theories, and maybe you pick up some concepts from different theories and you put it together. So it's also very good because it's like a tentative theory guiding your research. It's also a preliminary attempt to organize your data, organize your study. So it holds a lot of promise because most often your conceptual framework can lead to the development of a theory. So it's also very, very important. And let me just really say at this point that I've read quite a number of published articles or dissertations, and one of the things that you see repeatedly is the lack of a theoretical orientation for that study. And you would see it affects the quality of studies when you don't have a framework. You would see that the study lacks depth. Most times, because you didn't use a framework, there are some important variables that you miss out. You entirely forget about the variables because you did not use a framework to guide your study. So this is very important for us to note. So what are the benefits of using a framework? Because one of my objectives this morning is to try to convince us to really ensure that we integrate the use of a theoretical framework to our study. Number one is the fact that it helps us to delve deep into integrate ideas. I explained earlier, when you have a theoretical framework, you would see some of the constructs to assess. You will see some of the variables. So you know that, okay, I'm supposed to assess, for instance, let me use a typical model that most of you are familiar with, the health belief model. Okay, I'm supposed to assess variables under the modifying factors, variables like age, like sex, like level of education. Oh, I'm supposed to assess variables under perception. Perception, like, has different dimensions: perceived susceptibility, perceived severity, perceived threat. If you do not have that framework, there's a tendency to miss out some very important information, and you would have gone to the field, collected the data, and then you'll be struggling to interpret your data. So it helps us to delve into intricate ideas. It also helps us to ensure that our study is focused, is logical, and coherent. Aside this, it helps us in developing the research questions. It helps us to identify the key variables that we should investigate. In fact, it also shows us the relationship between some of these variables, and it also helps us to prevent shadow analysis and misleading conclusions. So I'm sure the next question will be that, at what stage do we use conceptual frameworks or theoretical frameworks? So I wanted to ask the question, but I think I've said it earlier, so I wanted to pose it as a question. So let me just want to present it. So it actually runs across the research circle. It starts on early. You can use it to provide the rationale for your study. You can use it to define the aim and your research questions. Like you would see that earlier when I showed you some samples. You can use it in setting your hypothesis. You can use it in outlining the methodological stance of your study. You can also use it for your literature review. In fact, for all my students, I tell them, when they are doing their chapter 2, you'd write in line with the theoretical framework that you are using for your study. So if you are talking about using, for instance, the socio-ecological model that has multiple layers, like the individual layer, interpersonal, community, institutional, policy level, then you'd have to write in line with that framework. You would give us discussions or give us literature based on the individual factors, based on the interpersonal factor, and on and on and on. So it helps you to write a coherent, of course, literature review. It also helps you in developing your data collection tools. I will show you that shortly. When you have a good theory, you're able to develop your data collection instruments, and it helps you to analyze your qualitative or quantitative data. I will briefly talk about some theoretical frameworks used in public health research and practice. But I want to know those who I'm talking to. So let me ask you this question: if you know any theoretical framework in public health research and practice, put it in the chat box. I'll look out for your post. Just mention anyone that you know. I'm already in the chat box. I'm seeing questions that will address that. Okay, so quickly, please, let's put in, okay, diffusion of innovation theory. Thank you, Christine. I want to see more. Okay, health belief model, yes. The health belief model is very popular. Okay, universal malnutrition conceptual framework, visual learning theory, visual cognitive therapy. Okay. So thank you so much, everyone. It's obvious that I can even see the proceed and the trans-theoretical model. So it's obvious that we have participants that are very, very informed about this. So let me go on to present some of the things you mentioned, actually part of the presentation for today. So let me go on and then share. So the very first one that I have here is what we call the health belief model. Depending on the material you look at times the structure for the concept or the model will be different, but just know that these constructs are the most important thing. So in all of the models you see, these are the constructs you see. You have constructs like the modifying factors. individual perception, and then cues to action and all that. So this particular model was developed by researchers in the US Public Health Services, and then their main they said, according to them, they believe that individuals are affected by perception and their beliefs about an issue. So the possibility that individuals will take action is influenced by modifying factors like age, gender, ethnicity, and all that, as well as their individual beliefs, their perception about the threat of the and the severity of disease, their perceived benefits, perceived barriers, self-efficacy, and perceived threat. So that is the underlying principle for the health belief model. So let me just list something before I move on. That what I'm showing you is what we call the models or the concept maps. So beyond this, you could also describe your theoretical framework in the narrative prose. So you can have a narration, a prose. You can also have representation, a graphical representation, which is what I'm showing. So what I'm showing you now is the model, which is a simplified graphical visual representation of what the theoretical framework is all about. So when you're writing your dissertation or your thesis, it is important to write out in prose your theoretical or conceptual framework. And it's also important for you to come up with a visual, graphical representation of the theory. So both of them are very, very important. So usually the picture is like this. You would have boxes, you would have arrows, you would have shapes. And these boxes that you see here, they stand for concepts, while the arrows show you the relationship between the concepts, or in some literature it stands for constructs. So these boxes stands for constructs, and the arrows show you the relationship between the constructs. So please note that. So this relationship will just show you some linkages, or it will show you there's a cause and effect relationship between this construct. So this is the health belief model. Like I said earlier, it was developed in 1950s by social psychologist working for the US Public Health Services. It's a psychological model, so it's a borrowed model from the field of psychology, and it helps us to explain and predict health-related behaviors. So it is based on the idea that people's beliefs about their health condition influences their health behavior. So if I believe that I am susceptible to a disease, there's a likelihood that I'm going to take action. But if I believe, if something is serious, if a disease is serious, but I don't think I'm susceptible, I don't think it can affect me, I may likely not take action. So that is just in simple form what this model is all about. So if you are talking about perception, if you are doing studies around perception, you need to look at this model. If you are doing studies around screening behavior, you also need to look closely at this model. Now, this is another theoretical model that we use in health promotion. So the first one we use in health promotion, research and practice, and this is what called the sociological model. It's also used in health promotion research and practice. So this model posits that individuals exert an influence on their environment, and the environment also exerts an influence on individual, so that there's a reciprocal relationship between individuals and their environment. So right in the inner circle is what we call is the individual, and the individual has characteristics like age, their gender, their knowledge, their skills, economic level, and all that. But beyond the individual, there are other levels of the system that has implication on the individual, levels like the interpersonal, community, institutional, and policy level. So we all know at times you want to take some action, but the policy environment or the institutional environment has implication on you. A typical example, you want to promote breastfeeding among women, but these women they work in the workplace, they work in a formal workplace, maybe like in a bank. So even if you want to promote exclusive breastfeeding among them, you have to consider what the institution where they work and what the policy orientation is for the institution. If you don't consider that, you can spend all your intervention and effort in trying to get them to exclusively breastfeed. But that will not be possible because there's a policy limitation, or there are some limitation in their institution, no lack of crèche, no places where they can convenient, no privacy for breastfeeding and all that. All this would have implications on the individual's willingness and interest in breastfeeding. So this is another model we use a lot in health promotion research and practice. Okay, so I'm moving away from health promotion now. I'm going into the field of health policy research. So this particular model is called the policy triangle framework. And the policy triangle framework was developed by Walter and Gilson in the 1994. And as you can see, there are 4 constructs here. You have context, you have the content, you have the process, and you have the actors. So this model posits that is usually used for analyzing policies. When you want to analyze a policy or analyze a policy process, you can use the model. Okay, you want to look at how the policy for tobacco control was developed in Nigeria. You can use this because you talk about the context, what was happening in the country when you developed the policy, and how did this influence the development of the policy for tobacco control. Who are the actors that drove the process? What was the processes they used? Was it advocacy? Was it lobbying? What processes did they use? And then what is the content of the policy? So this is the Walter and Gilson framework. It looks at several issues: political issue, economic, and cultural issue. Okay. Still in the field of health systems research. So this is more for health systems research. This one looks at the health systems. It is called the Donabedian model for quality of care. So this Donabedian model of quality of care is used for evaluating the quality of healthcare, and it has 3 main constructs. It has the structure, it has the process, and it has the outcome. So the structure will look at the physical attributes of healthcare settings. Where is this healthcare facility located? What are the physical attributes or characteristics of this healthcare facility? Then it also look at the process. What is the process used in delivering care to patients? What are the services delivered? How is diagnosis made? How is treatment made? So anything that has to do with processes or service delivery, you fall under processes. And then these are the outcome. So the outcome really talks about the effectiveness of this care, the outcome of the processes. That is what it looks at. So the effects of healthcare on the health status of patients or population. So this is a model that is popularly used in health systems research. So another area that I'm moving on to is implementation science. So I'm sure by now you know that different disciplines, different fields have their own theories. At times you can borrow from other fields if you think that you don't have a particular theory to explain what phenomenon you're investigating. So you're free to go on. For instance, in air promotion, we borrow a lot of theory from psychology, from sociology, from social sciences generally. So you can go on to borrow theories. And I also want to say that there are lots of theories. As I'm talking to you, I'm sure there'll be a researcher at the end of the world developing another theory. So day in, day out, there are several publications and different theories are published. So there is no end to this. So I usually tell my students that just try to start with having a basic understanding of as many models or as many theories that you can understand. Some of the new theories or new theoretical frameworks have constructs that are similar to what exists in the past. So for instance, you could have the term self-efficacy. You have the term self-efficacy in several other theories. So when you see it, you know that it's still the same self-efficacy, but it is presented in another way in this particular theory. So don't get apprehensive and think, well, I have to know all the theories in the world. It's impossible to do that. But just have the basic understanding of very, very common ones, and you can apply the knowledge when you see a new theoretical framework. So that's my advice generally. So this is the REAIM framework. This is a theory that is usually used in implementation science, and it usually guides the planning and evaluation of programs. So according to the REAIM frameworks, there are 5 key areas or 5 key constructs that are of interest. We have the reach, we have the effectiveness, adoption, implementation, and maintenance. So for the reach, for instance, you want to know how many people were reached what proportion of the target population were reached with this intervention? And effectiveness, how will I know my intervention is effective? So that is for effectiveness. Then adoption. How do I empower organizations to adopt my intervention, especially when the funding has expired? And then implementation, how do I ensure that the intervention is developed properly? At this point, you're looking at fidelity. So when you're taking intervention from one setting to another setting, there's a tendency for you, if you're not very careful, there's a tendency to lower the standards. So at this point, you will be looking at implementation. How was it done as per the protocol? Was it done as per the manual? So this is what implementation looks at. And then we have the final one, maintenance. How do we ensure that the components of the intervention are delivered over the long term? So this is just the re-aim framework. There is another one here, which is the consolidated framework for implementation research. This is a bit complex. I don't want to go into too many details, but it's very good because it's if you're in the field of implementation science, this is one of the most popular theoretical frameworks that you should know about. So it has construct like the intervention, the outer setting, the inner setting, process, and all that. But I will share this slide. You can always check up or read up about it if you are interested in this field. So it is a very, very comprehensive model. It was developed, it has about 39 constructs. So these are just some of the main constructs, but it has about 39. These are just domains. It has about 39 constructs, but it's very, very detailed. So this is the consolidated framework for implementation research. So I will move on to the crux of the presentation today. How do we align research questions to a theoretical and conceptual framework? I'm sure that is what is of interest to a lot of people this morning. So the first step is one, to identify the research problem or the issue that you want to investigate. And when you know that, then you can talk about the key terms. So for instance, my research issue could be breast cancer screening behaviors of women in a selected study, in a selected community or area. I may have discovered that a lot of women in this community, let me use where I live, if I do not, do not screen for breast cancer. So my research issue is this. They do not screen. Why don't they screen? So when you know your research issue or problem, then you want to go on to identify the key terms. Now, when you know your key terms, in this case now, the key terms are breast cancer screening, breast cancer and screening. When you know the key terms, the next step is to conduct a literature review to identify and explore established theories in this field. So you just go to Google Scholar. My key term, like I said earlier, is breast cancer screening. So I will just go there and type breast cancer screening plus theory. So when you type in breast cancer screening plus theory, you would see that a lot of theories, a lot of published articles will pop up that have theories in them. Now, when you have all these articles pop up, it's a lot of work. When you're already experienced and you know the models, when you just hear the issue, you can say, okay, we can quickly recommend the model. But if you're just starting off your career, your research career, this is a simple way to go about it. So just go to Google Scholar, whatever it is that is of interest to you, type that issue and then put plus theory. When you put plus theory, articles will pop up and you will now start seeing different theories that have been used in the past. And then you would start listing them. So make sure that you have a list of at least 10. If you want it to be more than 10, that is fine. But a minimum 10 theories that have been used in previous study. Now, when you have this list, you now pick each of the theory one after the other and do an in-depth study. You search for more articles, you read more about these theories, and ensure that you have a good understanding. It's an easy way for you to get to know more theories in the field of interest to you. Now, when you have identified, then you try to prioritize. You look at your context and look at your study, look at where you're doing your study, and you see what theories have been used in the past, which ones are used frequently. Because that's another important thing. You see that some theories are used over and over again. Is that a lot of citation? Then you know that most likely these theories are very, very good. So you do that literature review, and you prioritize. And you can also consult someone, consult experts. Okay, I already have a list of 3, 4. Can you please guide me? You can do it on your own anyway, but you can consult people. Say, okay, I've identified 3 or 4. And which of these do you think is most suitable based on the issue I want to identify? At times I have a lot of students come to me, so they just come and tell me, I don't know the theory to use, and I'm not going to help you to do the reading. You have to sit down and do the search. So this is the way to go about it. You go online, Google Scholar, put in the key issue, add theory to it. Theories will pop up, get a list of 10, and then go through that thing and then pick the most appropriate for your study. So when you have now selected what theoretical framework to use, you can develop your research questions to align with the constructs in the theoretical framework. I'm going to show you a sample shortly that shows you how you ensure that these things align. So I would be sharing a material from one of my students. Just a minute. Okay, so this is something from one of my students, and he worked on myopia. And this is a theory he used, the theory of reasoned action. And the theory of reasoned action has constructs like attitude, subjective norms, and behavioral intention. So you can see that he started by telling us what the theory is all about and explaining the construct in the theory. So according to him, attitude, or according to published articles, attitude reflects an individual's evaluation or assessment of a behavior or situation. And then he went on to tell us that this particular construct is linked with a particular research question he has. The research question is, what is the attitude of students on preventive practices for myopia? Then he went on to list the questions in the questionnaire that were used to assess the attitude. So note that, number 1, he identified the construct, and then number 2, he told me, or he wrote which research question is linked to that construct, and then he went on to list all the questions he has that he used to measure attitude. Let me go on to show you what that looks like here. So attitude is one of the constructs in the model he used, and these are the statements he has to measure attitude. Now, another construct in that model that I use, that theory of reasoned action, is subjective norms. So subjective norm refers to perceived social pressure or influence from significant others. And then you listed that as being linked with research question 3, and then it listed the questions to measure subjective norms. So let's go to the section in this questionnaire, and you will see these are the questions that you use to measure subjective norms. The last construct in that model is behavioral intentions, because that model posits that for people to adopt for behavioral intention to come on, or for you to show an intention to practice a particular behavior, you are influenced by your attitude, and you're also influenced by the subjective norms. So it has questions to measure attitude, subjective norms, and behavioral intention. So that way you can see an alignment starting from his research question down to the constructs in the model, down to the questionnaire. So that shows the flow between those key components of a research project. I'm also going now to show you how you You can use this to write your literature, how you can use your theoretical framework to write your literature. So for this, I'll be showing you a published study. Okay, so just a minute. Okay, yeah, I can see it now. So this is how the conceptual framework is used for to. I'm trying to increase the font. So yeah. So this is a published article that looked at physical activity in Nigeria. Specifically, it looked at the views of Nigerian school principals and teachers on opportunities and barriers for promoting student physical activity behaviors within the school setting. And it's a qualitative study. So if you look at what we have here, early on in this background, the authors mentioned that the socio-ecological model. Can you see this? I want to be sure you can see this, or should I increase it? Okay, I think it's better now. Yeah, the authors mentioned that the socio-ecological model was used. So the socio-ecological model is the theoretical framework guiding the study. And if you now go on, you see that they started discussing the issues. They started with a discussion of the individual level factors, and then moving on, they talked about so individual level factors, and then they went on to talk about the socio-cultural environment, the fact that Nigeria is a multicultural, multilingual, multi-ethnic community, and all this has cultural implication on the participation of young people in physical activity. So they discussed the socio-cultural environment, and then they went on to discuss the school level factors. So factors at the school level and policy issues. So here, if you go on to read on, you see issues on the physical activity in school, policy, the curriculum, the time allotted to. So this is how you can use your theoretical framework to guide or to frame your literature review or your background statement. And if you go further down in this article, you will see that they tailored their results using the same sociological model. So you can see issues around parental factors, and then they have school cultural limitation, which is like the cultural environment, and then they talk about factors at the school level, factors like number of PhD teachers trained, opportunities for physical activity in school, and all that. So that is how you can use your theoretical model to frame the development of your research questions, your research tools. You can use to frame your literature review. You can use to do your data analysis plan. So that's how it is. So I'm going to go back to the presentation, rounding up. I don't know if you have time, but I can see that the time is already up. So I wanted to do a practical of research on Google Scholar, but I think I'm going to skip that because of the limited time that we have now. So before I round up finally, I think at this point we can take the questions and answers. If that is okay, Dr.
Yeah, thank you so much, ma'am. I think the questions, maybe let me read. If you have questions and you want to ask, you can use the hand raise icon. But I would like to quickly appreciate Dr. Oluwashanu. Thank you so much for the very explicit and clearly delivered session. So I would like to read some of the questions on the chat. But if you have questions, I think some of the questions have been answered. Right, but I still want to read them to ensure that I don't miss out any. So once again, I would like to appreciate you. Now, Eric asked that what then is the distinction, sorry, what is the distinction between literature review and a theoretical framework? Well, I think you have done that, but ma'am, can you quickly maybe chip in maybe a little to add to what you said earlier? Over to you.
So for the literature review, what you are doing is an extensive search of the literature. It could be a systematic search of the literature to know what information exists. So you are reading articles, reading publications on that issue of interest. But from your literature review, you can identify the theoretical frameworks. Okay, as you read, of course, as you read, you should know that, okay, these are the frameworks used for this particular study. But it's not synonymous, it's not the same. Your theoretical framework helps, it's a theory. It's based on what exists previously. So it looks similar, but they're actually very different. For literature review, you are reading different materials, you're reading and doing an extensive search of the database to know what information exists with regards to a particular issue. So it's more broader, but your theoretical framework kind of helps you to narrow down your research and helps you to pin it down. That this is what I'm going to do, and this is what is going to the framework that is going to guide my study as I go on. So similar things, but they are different. Thank you, and over.
Yeah, thank you. I think that's in addition to what you said earlier too. Now, can objective or hypothesis influence the choice of framework? You have also spoken about that, but you can just shed a bit more light. Over to you.
So can your hypothesis, so number one, you start with your problem. And when you know the problem, it can influence it in a way. When you know the problem, you are supposed to read wide, and you don't start with hypothesis. That is the funny thing. You start with an understanding of the problem, and then even looking at the conceptual or the theoretical model, you would see some that would tell you that there should be some relationship between these constructs, and that can now inform the hypothesis you're going to test. So your theoretical framework comes before setting the hypothesis.
Yeah, thank you for that. I would like Dr. Chinedu Echi Williams. You can unmute yourself so that you ask Dr. Bashan. Please go ahead.
All right. Thank you very much to the organizers and to the presenter. Thank you, ma'am, for an enlightening presentation. I just want to ask this question for clarity. I typed it in the chat, but let me just ask because it's something I see a lot of my students do. Is it smart to use more than one theory for a study? Because I was of the impression that one theory is enough. If you have one theory that can explain your study, I believe it should suffice. But I said I should find out from a more superior opinion. Thank you.
Okay, so it is actually okay. It's possible and it is okay to use multiple theories, but it has to be in context. Let me define it. So in my department, we usually encourage our master students to use only one theory. Because if you are using multiple theories, then there is a duty to measure construct in all the theories you use, or most of the theories you use. And we know that for now, they are still learning. They are still at the preliminary stage of research. We don't want to get them overwhelmed with the process. But for our master's, PhD students, they have to use multiple theories. For instance, let me use my example. For my theory, I worked on physical activity in secondary school. So I used two theories. And why did I use two theories? I used one, the psychological model that I explained earlier, that talks about the individual, interpersonal policy. I also used another theory to complement it. I used the theory of reasoned action to complement it. The ecological model was important because I was working in schools and I needed to study factors at all those different layers. But I saw that when I got to the individual level, I really could not zoom in well on my individual level because I didn't really have constructs to measure at that level, beyond just age, sex, and educational level of parents and all that. I needed something more important. So I had to integrate the theory of reasoned action into the individual level. Now, the theory of reasoned action has three constructs. These are attitude, these are the subjective norms, and these are the behavioral intention. So that helps to enrich the information I gathered for the individual level. So it is okay for them, but they must have the competence. If they are still master students, please, they should just stay with the one construct, one theoretical framework. But when they have mastered this, then they can explore. So it's right and okay to use multiple models. But when you use multiple models, then you know they are measuring multiple constructs, and that can be overwhelming. Thank you, and over.
Yeah, thank you once again. Yeah. Yesuru Karim, please ask your question. You can unmute. Yesuru Karim, if you can hear me. Oh, okay, fine. Go ahead.
Hello. Good morning.
Yeah, good morning. You're audible. Yes, good morning.
Okay. Thank you very much. I want to make a clarification. Thank you very much for the very enlightening presentation. In one of the slides, you mentioned the fact that a particular pictorial representation is used even for a theoretical framework. So I want to know what differentiates, when we draw a diagram now, what now differentiates it from a conceptual framework? But I used to think that theoretical framework is about listing theories and trying to explain how they relate to your topic, while the conceptual is now trying to conceive your idea in your study, the relationship between the variables in your study in a diagrammatic way. So can we use a diagram to represent theoretical framework? And so, what differentiates that particular diagram from a conceptual framework? Thank you very much.
Okay, you're welcome. So these are diagrams, and these are theories that exist in the literature. All this I'm showing you, this is the ecological model, it's a diagram. So you can use the diagram, at times we call it the concept map, or we call it the model. We can use the model or concept map for both conceptual and theoretical framework. So all these theoretical frameworks that we have already existing in literature, they also have their own diagrammatic representation. So if the diagram is not limited to conceptual framework. So for conceptual framework, like I explained earlier, it is based on your own conception. It is based on maybe your exposure to what you've read in literature. So it can be informed by theory. It can also be informed by your experience in the field. But you cannot just pick your conceptual framework from existing literature. It's not there. It's not as if it's published. It's not there. It is what you have conceived, or what you have it's based on your own conception. But for theoretical framework, this one is already in for instance, this ecological model, it's already in literature. If you just Google ecological model, it will pop up this. And so the use of the diagram is not limited to conceptual framework. It can be used for both theoretical framework and the conceptual framework. Thank you, and over.
Okay, thank you once again, Dr. Duashanu. Someone sent that, thank you, Dr. Duashanu, for the enlightening session. Is it compulsory to have theoretical framework and conceptual framework in the same dissertation or in the same research work? Over to you, ma'am.
So, yeah, so usually I've read literature that it's advised that you stick to one and you should not use the two. Because already when you start doing but I've read also in some schools that they want you to start with a theoretical framework, but towards the end of the dissertation, they expect you to have your own conceptual framework, which is informed from the data and your understanding of data. So it's a bit, there's no definite school of thought on it. But generally in my department, for instance, you only use your theoretical framework to explain to guide your study. So the conceptual framework, for those that use it that way, they will start off with theoretical framework, and then towards the end, they will have their own conceptual framework based on what they found from their study. But generally, the school of thought is that you should limit yourself to either the conceptual or the theoretical framework. Thank you, Anuva.
Okay, thank you. Okay, I would like to allow Tobiloba Adewumi, I think, to ask. You can unmute yourself. But before you just do that, someone suggested that it would be nice for you to give us the brief Google Scholar demonstration. Please, I don't know if you can kindly do that within a few minutes. So Tobiloba, over to you. Unmute yourself.
I can.
Thank you, sir. Good morning. Good morning, ma. Well done, ma. Now, my question is, I used to think that to develop hypotheses, I would just have to play around my variables. But now I think I'm knowing better. But ma, I want you to practically shed light on how to develop hypotheses using a theoretical framework. Then also I was thinking that if I would just be checking the relationship between one construct and the other to develop my hypothesis, then maybe it's not yet making sense to me so much. I was thinking, then does it now mean that I'll be picking maybe one question out of all of the questions in my questionnaire, the questions I have on my tools? Will I be relating them with another question, or how does it play out? I think I'm not getting that so well. Thank you, ma.
Okay, so let me start by saying that if you remember the question, go on.
And what if amongst all of my research questions, I have just one, okay, perhaps I have, for instance, if I have like 5 research questions and it's just one of my research questions that the theory I'm planning to use can only explain. You know, for master students now in your department, you can only use one theoretical framework. And I'm constrained because the theory I'm planning to use, my theoretical framework, is only explaining one of my research question. Is it not limiting that way? Thank you, ma.
So I was okay. 2 things. Let me start by saying, how did you arrive at picking the theoretical framework you picked? Because at times the theoretical framework may not give you a comprehensive view, and that may tell you that there may be a need to change that framework, that this cannot support my study. So that the fact that you have picked does not mean that it's the best. In fact, we usually say it's something that you keep working on until you are sure that no, this can support all the questions and variables I have. It should not just be supporting one thing. It should support the majority of what you have in your questionnaire. So I must say that correlation between the constructs in your model and your questionnaire. At times you see people will tell you they just slap on models or slap on theoretical frameworks on their study. And when you go to the questionnaire section, there is no correlation. They are measuring attitude and then the questionnaire, they're measuring perception. No correlation at all. So you have to look at it again. You may have to go and do, I don't know how you arrived at picking what you have picked. You may have to go back to the literature and see that what theories are used in this field that I want to investigate. So that is one. Then you said something about the questionnaire and then maybe using just one question. If you look at the questionnaire I shared earlier, it's not just one question does not measure a construct. In fact, one question may not even measure a variable. You have at times to have series of questions to measure a particular variable. So you can't be talking about just using one question to maybe cross tab another question, except I don't get you well. You have series of questions to measure a variable or a construct. So I don't know if I didn't get you well, but that's little I can say. But we can always
Thank you once again. Okay.
And come and discuss this further. Okay.
Okay. Yeah,
so
Mrs. Serufina Medoye, over to you, please.
I want you to what you call it in English, demonstrate
the Google Scholar
this.
demonstration.
Okay. So should I go on?
Yes, please.
Okay, I can be taking the question while that is going on. So that,
okay, yeah, Mrs. Rufina Menoye, please, you can ask your question. Thank you.
Let's hope that I can.
All right. Thank you very much, Ma, for the insightful presentation. My first question had been answered. I wanted to find out at what point do we bring in the conceptual framework in the chapter 2 literature review, but you said after we have done the theoretical and the review and empirical review, we can now, conclusively make our own conceptual framework. But the next question I want to ask is, we're talking about aligning our theoretical and conceptual framework with our research questions. Now, Ma, is it okay to base our theoretical, our conceptual framework using our variables, at least for basically for PhD students. Like if you have 3 variables, 2 dependent variables and 1 independent variable, is it okay to base our conceptual framework, because by then we'll have finished with our theoretical and empirical review? Is it okay to base it on the variables in the topic we are using? That's my question. Thank you very much.
So please, if you don't mind, I want you to clarify a bit further. So you have already used your theoretical framework at the beginning, but now you've collected data. You've collected data, and you now want to have your conceptual framework at the end based on data you have. Is that what you're saying?
Yes, ma. Yes, ma.
Okay. I'm sure that you know that since you started with the theory, some of the variables you mentioned at that point, you would still be relevant. So why do you want to just pick some variables for your conceptual framework? I want to understand your background thoughts on.
Yes, if during the process of data collection, you discover that like you may have had in mind using like head belief model, social ecological model for your conceptual framework. That's
the theoretical framework.
Yes, you have had those.
That's the theoretical framework.
You use those theoretical framework. Then during the process of data collection, you discover that there is need. Meaning that those theoretical framework you used, and maybe the questionnaire or during the process, there are some gaps that you have discovered now that were not covered.
Okay, now I understand. Okay, yes, okay. So you're not thinking that can you add on more constructs because some gaps have been found. Yes, it is. In fact, at that point, you may explore integrating multiple theories. And if that does not work, then you can go on to develop your own conceptual framework because you notice that there is a gap and the existing theories cannot support your data. So that is allowed. Is that okay?
Thank you very much, ma'am.
Okay, so I don't know if you can see the Google Scholar. I'm already on the Google Scholar page.
Yes,
I've already shared.
We have your screen.
Okay, so like what you have in the slide is breast cancer screening plus theories. So that's what I'm searching for. So already you are seeing the theories pop up. When you start opening this, you will start seeing them. So you can see theoretical models for predicting and improving compliance with breast cancer screening. This is a cognitive social theory for breast cancer screening. This is theory of planned behavior. This is also a theoretical framework. So when you start, so I don't know, I'm moving on to the articles. Can you see the articles?
Yes.
So already you can see. So this article describes the application of health belief model, theory of reasoned action, chance theoretical model, and the prospect theory to breast cancer screening. So already this tells you that these are some of the theories used for breast cancer screening studies. So you could just you just start listing the theoretical models and then working on reading them. So that is just how it is done. Is that okay?
Yeah, thank you so much. I think there are a few more questions before we round up. I saw Dr. Adebayo's hand earlier. I don't know. Maybe you want to chip in some things. Yeah, Dr. Adebayo, please.
Okay, thank you very much, Dr. Olesomi. It's a privilege being here. And I've come for 2 reasons. 1, to learn, and 2, to support my colleague, Dr. Oluwashanu. I wanted to respond to the last question, and that's regarding the person that asked about conceptual framework vis-a-vis theoretical framework. Now, everything we've had about theoretical framework, really, they are grounded. It provides a basis for our research, at least from what is known. Now, conceptual framework on the other hand, is needful to be able to explain the interrelationship between our variables. And don't forget that we're told this morning that you must have been able to define the problem through your research questions or your objectives. So please, if you can't hear me well, I'm in transit. Apologies for that. So what we need to do, okay, thank you. So even regarding conceptual framework, it helps you to be able to have a kind of vivid description on how you are going to relate the variables of interest in your research, especially if it's a study wherein you are trying, to determine association between variables, or you are trying to find a cause and effect, or maybe the influence or the impact or the effect of an event even over an outcome. So the point we are making is that you, even just like you're able to define your theoretical framework, the same way in your review, you also bring up even something very descriptive and in terms of a model on how you are going to relate your variables together. It's part of the planning. So if you have that in a session of your literature review, it also helps you to be able to know how to craft your methods. And when you are presenting your results, it makes it so clear. Now, this same person that asked the last question talked about something that I've not mentioned today, which is empirical review. In a good literature review, there is conceptual review. Conceptual review is review of your concepts. There is theoretical framework, also a level of review. There is empirical review. Empirical review is what speaks to your objectives, at least from the studies that have been done before now, before you now go to your conceptual framework, which helps you to be able to see, it will present how you are going to relate your variables together. That's what I wanted to just allude to. Thank you very much.
Yeah, thank you so much, Dr. Adebayo. Thanks for the insights and contribution as well. Yeah, there is one more, and I think we'll take that and maybe one other question, then we can round up. It's past the hour already. Francis, please, over to you. You can unmute and ask your question. Francis.
Thank you, Doc, for the insightful presentation. Please, I want to find out whether there is any difference between a model and a theory. Thank you.
Okay, over to you, Dr. Dashan. You are muted, please, if you.
Okay. So a lot of all these terms, I must say that even in the literature, you see that some of these terms are used interchangeably. But generally, if you remember what I said earlier, when I was describing the concept map, I said at times we call it concept map, we call it the model. So that diagrammatic representation is the model. But the theory itself, it's for instance, the ecological model. Let me use that as an example. Saying the theory of that ecological model posits that individuals exert an influence on the environment and the environment exerts an influence on the individual. There is a narrative description of that theoretical framework. So it's a theory. The ecological model is a theory, but you could have a diagrammatic representation of this theory, and that is the model for it. So it's not as if, so the theory actually talks about that body of knowledge in regards to a particular issue. And that theory for sociological model talks about the fact that individual level factors, interpersonal, community level, institutional level, all these influences an individual. That is the theory. But the model, when I now show you that picture, that diagrammatic representation, it's just a representation, it's the model of that theory. So that's the simplest way to define it. But when you read literature at times, you get a lot of what I call echoes from all this. But that model simply means the diagrammatic representation. I wanted to respond to a question in the chat box. Somebody asking that I thought that theories, that your conceptual framework is, let me just read it the way it is so that I won't. So I always thought that the conceptual framework is developed based on the theory. If you remember earlier, I said that the conceptual framework is more like your own conception of the story, but it's also It could be inspired by the theory that you know, what you have read with regards to this, what existing body of knowledge is there outside regards to that issue, what theoretical framework. So if you know some of these theories, it could inform your concept. But the only thing is that your conceptual framework is what you develop. You are the one that conceptualize it. You can't go and pick it in the existing literature, but the existing literature can inform it. It can guide you. And you can add on other things based on your knowledge of the issue and your experience or your day-to-day experience with that issue. So I'm not saying that conceptual framework is not informed by theories or is not informed by existing or empirical data. No, conceptual framework is also informed by theories in the field and empirical information. Thank you, and over.
Yeah, thank you so much, Dr. Oluwashanu. I'm very glad and happy, excited as well to listen to you this morning. I also had personal questions that you have answered in the course of the presentation. So thank you so much for that. We've listened to aligning research objectives with theoretical and conceptual framework. And I believe that day by day, we are becoming better researchers. We have been doing this for like a period of 4 months now on Saturdays. And I think we have not skipped any so far. So conducting your research without a strong theoretical framework might lead to shallow research. So colleagues, I want to encourage you, let's ensure that as soon as the recordings are available, we'll listen to it again and try to incorporate some of these things into our ongoing research. So I want you to show your appreciation to Dr. Oluwashanu using the various icons on your dashboard. And I would like to tell us that there will be no session next week. Next week, Saturday is the last Saturday of the month. So we'll be continuing with other topics based on what colleagues have suggested earlier when we started. We'll be continuing one of the Saturdays in January. So I want to appreciate Dr. Oluwashanu once again. And thank you, Dr. Adebayo, for joining us. I would like to add that Dr. Adebayo read my first manuscript ever in life. And I want to appreciate him once again for always being there one every now and then. Thank you so much, Dr. Adebayo. So I want to wish every one of us a very Merry Christmas and a prosperous 2025. Someone requested for previous sessions. All the recordings are on the social media platform. I want to actually copy all the handles on this chat box so you can take a look. I think I've done that. Let me send to everyone so that you can have a look. So we always post the recordings on our social media, the link on the social media platform. We have a YouTube channel where you can see all the recordings of the previous session. And the link to these channels are always posted on LinkedIn, Facebook. So you can decide to subscribe to our social media handles depending on the one that you use, so that anytime we post our activities and research activities and training is not the only thing that we do. We have a lot of other activities that we do. So you can do well by going to our social media handles and see some of these activities to save our time. So once again, I would like to appreciate Dr. Oluwashanu for the session. And I would like to also thank you all. I think we've had about 70. At a point, we had almost 80 participants, but I think 70 participants have been consistently on the call. So thank you so much. I wish you once again a Merry Christmas and a prosperous 2025. Keep writing, keep publishing, and keep contributing to science. Have a restful weekend. Bye.
Bye. Thank you, sir. Thank you, everybody. Thank you, Dr. Bayo.
Thank you.
Bye.